Good morning, Prof. McNamara, and thank you for joining us today. I'd like to chat about the Progress Women in Surgery Fellowship. And I suppose a good point to start with is that despite more than 20 years of gender parity among medical graduates, female consultant surgeon numbers in Ireland still remain low. And why do you think there is less female representation within this career path in Ireland?
Well, thank you for inviting me, Alison, and it's a pleasure to speak to you this morning. I suppose it's a complex issue about why there are fewer female surgeons than male surgeons. I think if we look at sort of the entry to the profession, we know that for more than 3 decades now, there have been 50% medical graduates who are women. So it is a bit unexpected, really, that there would be so few women in surgery until recently. And when we looked at the factors that were contributing to that, I suppose one factor was that female medical students were inclined to not even express an interest in surgery. And we think that was because they were seeing, very little representation from women. When we developed the Progress group to, at the invitation of the president of RCSI, to look into this issue, I was very surprised to hear from our medical student representatives that some of the medical students that they surveyed had never met a female surgeon, even though they were already in an Irish medical school. I must say I found that shocking, and so it's not surprising that people perhaps wouldn't visualize themselves in that sort of role if they aren't meeting women as part of their training. When we did the work with the Progress group, we found that, in addition to those barriers to entry, which seemed to be self-imposed in that people ruled themselves out as opposed to maybe exploring surgery, trying it out and seeing if it was for them. We also found that there were some issues moving through the pipeline in surgery. Training was very long, it's onerous, and it's competitive. And at the exit point, obviously, of a consultant interview, that's a competitive process too. So we found that there were some things that we could improve at each step along the way.
Excellent. Thank you for giving me those insights.